Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by my very eloquent co-host, Dr. Jason Martin.
Eloquent and loquacious.
He is a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Very good.
It's November. Are you coming down off of your Halloween high?
I love November. November is like a great month. I don't like February. February is
nobody
too cold.
likes February.
Yeah, February is not really a great month.
That's a stupid holiday.
So, but I definitely love November. I love Thanksgiving. It's one of my favorite holidays too.
See, I would actually say that Thanksgiving is probably my favorite holiday because it's got the good food and the least amount of like social pressure. No gifts.
Right.
It's just fun. Football. You have football all day.
Football, you eat. Who cares?
Yeah.
Still candy corn.
Oh.
Yeah.
So, okay.
Gotta bring it up, Nils. Like talking about like cocaine to a cocaine addict.
But this is even better. So, Nils, we're filming this in October.
Thank you.
Mm-hmm. And candy corn came out on the shelves, September. And for a while, I was very good. As everyone knows, if you listen to the Best Year of Your Life challenge, I am preparing for a photo shoot. So I was not going to buy any candy corn. But then I'm like, you know what? I will. So I did buy a bag of candy corn. And
there's a lot of calories in that candy corn.
Well, you know where that candy corn is? It is in the gun safe. You know who does not have the code to the gun safe?
Yeah.
That's right. Because... Yep. So then I realized like, oh, okay, well, this works. So then this was when I was sick. We were at Walmart again. I'm like, I walked by the candy corn. I threw another candy corn. I'm like, right, straight in the safe. So, yep. I was given a refeed by my coach and I just wanted rice. I'm like, I am not touching that candy corn until the end of the month.
This is so esoteric, but in Pulp Fiction when he opens up the briefcase and it's glowing gold.
That's
like
my
you never know
corn.
what it is. It was probably candy corn.
It was candy corn. It wasn't my mind.
You have to show that right here.
Yeah. Oh, candy corn. I signed up. So Brock's, who is the best candy corn, and then we will get into this episode, I promise. Brock's candy corn is by far it is the goat of candy corn. It's made with real honey. It is the best.
Is there any other brand?
Not in my mind. I literally will pass. Like I am not, like I love candy corn, but I don't just love any junk candy corn. Like it has to be Brock's. So Brock's was doing a thing this year to like, you submitted to be your biggest fan ever. And I did. I submitted to be the biggest candy corn fan ever.
Oh, you probably are. Yeah.
I don't think I won. They were like, this middle-aged woman wants to be the biggest candy corn fan ever. We were hoping for a social influence.
Younger person.
Yeah, someone who has a social media following. So anyway, if you would like to.
Wouldn't it be funny if Kanye West was like the Brock's spokesperson?
Candy corn person. So
all right.
Now we can get back to the podcast.
Yes.
So if you would like to, if you're listening to this and you're like, wow, I want to see these two people who are addicted to candy corn, please follow us on YouTube at Jason Martin MD. You can also find us on all social media platforms at Beauty and the Surgeon Podcast. And let's get into it. So this month we are talking all about thighs, turkey thighs.
Yeah. Very apropos for the month.
Everything you need to know about thigh lifts. And this will be a two-parter. So this will be November 1st and 15th. So you can get all your thigh thoughts out of the way before Thanksgiving, and then regret can hit in December.
Yeah. And then we'll take care of business in January, which is usually what happens.
Yes. So let's jump right into it. The way we start off most of these episodes where we talk about a specific surgery is
what is the word that you're about to say?
The statistics.
The
stats.
Good.
Yeah.
She's been practicing.
Oh yeah. I re-listened to our podcast.
It's like the King's Speech. She's had a
oh, it's never
teacher.
It's never here to stay.
Yeah.
So thigh lifts are not a hugely popular procedure in the world of plastic surgery for a couple of reasons, which we'll go into a little bit during this podcast. But there have been quite a few more done since we started tracking this back in the year 2000, about doubled in those 20 years. So it's definitely becoming more popular. Still highly dominated by women. Men doing this procedure in 2020 was 500 out of over 9,000. So not that many, but that's also, we'll talk about why. I mean, men don't tend to carry weight in their legs. They also have skin integrity that allows them to bounce back from weight fluctuations differently. They don't give birth to children. So there's a lot of reasons why men don't do this as often. The highest category for age is, again, kind of the sweet spot of when you can afford it and when you're a good candidate for it, which is somewhere between 30 and 60. Few in the outlier ranges, but that's mostly where it's going to lie. So.
But it's going to be more common. It is more common because of weight loss surgery and Ozempic and things like that.
Massive weight loss. Absolutely.
Yeah.
Yep.
So we're going to see this surgery is going to continue to increase over time because of our focus on weight loss and either a treatment or these medications. So
yeah. So maybe we'll see it double again. But if we're still podcasting in 2040, maybe. I'm game.
I'm down.
Yeah.
we'll have like 3 listeners and it'll be the last ones, but yeah.
Maybe. Yeah. So let's talk about, I totally forgot.
I was gonna say, what's in your lap?
Nils, we got talking about candy corn. I lost all focus.
Element's got to figure it out.
Yeah. So this awesome black envelope showed up. Super excited. So Element has sent us something. I don't know what it is, but it feels like a hat. I'm just going to say it.
Oh, yeah.
And it is.
Nice.
It is a hat.
They got swag.
Ooh, it's a Nike. It's actually a nice hat.
Dude, now they're picking up the swag. What's next?
Yeah, really.
And some more Salty Soul stickers. Yeah, which I love. And Stay Salty is probably my favorite thing ever. So thank you so much, Element. Like it says Stay Salty on the back.
Yeah, Element's got it going on.
This is a nice hat.
That's a nice hat.
Yeah, it's the stretchy. It's the golf one, so it's super stretchy. Oh, I'm taking this hat. All right. So what can a thigh lift do? Let's jump right back into this.
So a thigh lift is amazing. By the way, a lot of people are candidates for thigh lifts and they don't even know it. The first and foremost thing it could do is reshape your thighs, right? Amy. Ramey's my sister.
Mm-hmm. Yeah. Yes. And how does it reshape the thighs?
It can reshape the thighs by removing excess skin, excess fat, and it can do that in a couple different ways with different types of incisions.
Which we will talk about. And also, it can just make your legs more balanced or proportional to the rest of your body. This is, again, where you see this more with women that have heavy, quote unquote, heavy legs. We get that a lot with women. They're like, my legs are just so heavy. My legs are heavy. Or I carry all my weight in my lower half. And that is very much hormonally driven, more so in women. So it can kind of make your legs match the rest of your body. How many times have we seen that, Dr. Mark, where a woman, like, literally, it's like they're like they come in, they're usually almost always wearing dresses. And they look like a teeny tiny little person. We're both like, why are you here? And then we have them put a gown on. It's like, oh my gosh,
wow,
like
those legs don't fit your body.
They don't fit your body.
Mm-hmm.
I mean, one of our favorite patients ever was so much that way. Like she'd lost a lot of weight, but I mean, her upper body was so little, and like her legs just did not fit her body.
Yeah.
At all. So a thigh lift is a great option to make your legs match the rest of your body. Also, enhance your self-image and confidence. Absolutely. Now, does this mean that your legs, you'll have a thigh gap? That's always my favorite when we're like, I'm going to have a thigh gap after surgery. Like, probably not. You're a woman. Like, your pelvis doesn't really allow for that unless you are like ridiculously thin or just naturally built that way.
Everyone's dreams, Amy.
Yeah. But can definitely improve your self-image and confidence. Yeah. I mean, thigh lifts really can. I mean, it's something that when you struggle with excess skin and fat in this area, it definitely can start digging away your self-image.
Right. And it's not just a showy thing. It's the way it feels, just like heavy or sagging breasts. It's the same kind of gestalt of how you feel after the surgery. Things feel tighter, lifted, and better. And that's really transformative for people.
The way pants fit. I mean, we've done surgeries on women who like literally were they couldn't wear jeans. They had to wear all like stretchy pants or leggings. And then they come in later.
In the past year.
Yeah.
Yeah. They could not wear jeans because their upper body is fairly normal and the lower body was so heavy that nothing would really fit. And then we've decreased the actual circumference of their thighs, decreased the excess skin, decreased the volume, and they can wear jeans and they come in with jeans on. It's like,
I love it.
It's like a celebration.
Yeah, it's like my favorite
thing.
They
literally wear the jeans to show us,
yeah.
which I have to tell you, this fills my heart. It is awesome.
Yeah.
So, and that's not unusual. I mean, I know that we do a lot of these. We're experts in this surgery. We attract people that want this surgery, but we get this on a regular basis. People that really are imbalanced. They're not really balanced well. And it really comes down to their thighs, mostly the inner thighs, but it can be the outer thighs, knees, everything. We've
done the knee lift. So what can a thigh lift not do? I like to go to the opposite way. So it's not going to fundamentally change the structure of your leg. So if you have heavy legs, you still are going to have your legs. Like we can change the contour, we can remove some fat and some skin, but like ultimately, the musculature, the shape, the angle of your femur to your pelvis.
Yeah, the thickness of your bone,
like
all that kind of stuff.
Those things won't change.
Yeah.
Also, it's not for just removing fat. So to be a good candidate for a thigh lift, you need to have excess skin and fat. If you just have fat, we do that with lipo. You don't need a thigh lift.
Yeah.
So that's a good thing, right?
We have a good lipo episode, by the way.
We have many good lipo episodes. And the other thing...
Yeah, which one is he going to choose?
Right, I know. This is like spin the wheel.
Myth busting? I don't know.
Yeah. And no surgery in our plastic surgery world at this point can stop gravity or aging. So the things that led you to this place where you need this surgery, being a thigh lift, could potentially persist in the future. And we'll talk a little bit more about that as we get further into this
along
podcast.
with that, if you lost a lot of weight, you need a thigh lift because of that, and then you gain weight again and lose it. Like, you could run into the same problem over and over. We always talk about maintaining your weight and getting into a maintainable weight before surgery. Oh, how we steal the thunder.
Yep.
Always.
So that we'll just go right to the next let's just go right to the next slide. Who's a good
I'm way
candidate for
ahead of you.
surgery? Yeah.
I'm the leader of this dance.
Yes.
Right? You follow my lead, my steps.
Stable, healthy weight. So yeah, to be a good candidate
Or
for
I
this
could look at the
procedure.
slides beforehand. That's okay.
Yeah. So who is a good candidate for a thigh lift? Like you were saying,
Someone who's healthy.
stable, healthy weight.
And someone who has a weight that's maintainable.
Mm-hmm.
And it doesn't have to be a perfect weight. Everyone comes in and like, oh, I need to be this
Well,
weight.
because it's this.
A stable, happy weight.
Mhm.
Yeah. And that's a real misnomer. It's really hard to get whatever you idealize as your best weight. That sets you up for failure because especially as we age, it's going to be very difficult to get to that weight. You want to get to a weight that's maintainable and healthy.
Mm-hmm. And I think going along with that, though, like you were intimating that being committed to leading a healthy lifestyle, we won't do most types of like more massive skin removal surgeries on someone who has not maintained a weight for at least 6 months, preferably a year, especially after a massive weight loss. So if you come in here and you're like, I lost 60 pounds. Today was the 60th pound I've lost. I want to have surgery. Had you ever been able to maintain this weight before in your life? Nope. Okay. Like maybe we need to see if you can maintain this weight for 6 months. And
Right.
that's only to help you have a better
Right.
outcome.
And by the way, the Ozempic thing and the GLP-1, is that right?
That's correct,
Yeah,
GLP-1
GLP-1 medications sets up a real conundrum because if you go off those, it shows, the evidence shows there's a big rebound.
Mm-hmm.
So if you did GLP-1 medications, inhibitor medications, and then you did your surgery and then you stopped taking those and you rebounded, you could be back in a bad place. So that sets up a conundrum. Also, for weight loss surgeries, we like to wait at least, a year usually to where you get to after your plateau, and people usually plateau.
Well, they'll usually rebound a little. So
Yeah.
people will get to a very low weight that's maybe not healthy.
and then they'll rebound, and then they plateau.
And then they'll stay.
Yeah, they'll plateau.
Yep.
So once you get to that plateau level, we usually like to wait till even after that.
Yep.
So
And that's where that stable, happy weight comes in. You want the best outcome for life with any time you're spending a lot of money for elective surgery. So making sure, and people will sometimes ask like, well, oh, I'm, maybe 5 pounds heavier than I normally am. That's fine. Everybody has weight fluctuations. We're not weighing you every time you come in for surgery and be like, oh, well, your surgery is going to disappear if you gain another 5 pounds. We want this for the health of your surgery and the health of your life. So being committed to leading a healthy lifestyle just means that you're at this stable, happy weight. You're not smoking. You are independently mobile is one that I put on here because this is very important. After a thigh lift procedure, you will walk after surgery. You will not be bedridden. You need to walk. In fact, you will not be comfortable sitting. So you need to be able to be independently mobile. You can walk. You can get yourself around to have this surgery. So you need to be healthy. You need to have a healthy lifestyle.
You need to have a strong enough upper body
Mm-hmm.
to be able to lift yourself up by yourself.
Yep.
These things have to be considered. If you're frail or deconditioned, you can't do this surgery.
Mm-mm.
So, and you may want to do it, and we understand that, but you're not a good candidate.
Yeah.
We'll talk about this, but our big concerns with this is not being mobile, is infection, lack, poor outcomes, and most importantly, blood clots.
Mm-hmm.
And these things, blood clots themselves, are life-threatening. And so if this is an elective procedure you're doing because you want to improve yourself, clearly you don't want to end up in a bad situation where something's life-threatening.
Yeah.
So you're going to have to move after surgery. And by the way, it's not easy to move after the surgery.
No.
You have to force yourself a little bit. You have to be strong-minded and kind of get out there and do what we tell you to do. So
Mm-hmm. Yeah.
and that means that you have to be able to move, right? If you have baseline mobility issues and then you do this surgery, you're kind of really putting yourself in a bad position.
Yeah, and that is a unique thing to this surgery. We had in some of our previous thigh lift episodes. Actually, I think it was a thigh lift episode that I sent a couple years ago to Sarah, and I had a slide that said special considerations, and you were like confused by what I meant, and I'm like, oh yeah, like things like a toilet extender and like other things that this surgery more than any that we do on a regular basis has some pretty unique things that apply to thigh lift and don't really apply to other surgeries that
Right.
we do. So there are some special considerations.
But that was
with
a
this
running
surgery.
joke that we're going to have swag with our logo on it for a toilet extender.
Mm-hmm.
And then you made fun of the way I say toilet.
Well, you are getting better. You're saying it like a normal human. Say sconce.
Don't even start. with that. say statistics.
Statistics.
Yeah,
How about otolaryngologist?
Oh my
I
gosh.
cured myself of that with our beauty.
Yeah. You got that stuck in my brain.
Our new beauty, how to choose a surgeon. All right, let's take a quick break, and we're gonna come back. We're gonna talk some more about meeting your surgeon, how to pick a surgeon, all that good stuff.
All right.
So, Dr. Martin, I got something super exciting to talk to you about.
Yeah, what do you got?
Well, it's actually something you and I were talking about earlier in the day, which is this awesome supplement that we've both been taking called Magic Mind.
Yeah, I actually really like it.
You want to talk about why you like it, then I'm going to talk about why I like it?
Well, I like the whole backstory. The backstory of it is what really hooked me.
So you love a good story.
Oh, yeah. I mean, so you have this entrepreneur, like a Fortune 30 under 30 person. He had this company called, I think it was Tilt, and it was building up the company, working late hours, drinking tons of coffee, and was 26 years old, and then started to feel terrible, saw his internist, and then ultimately ended up in the emergency room and had something called atrial fibrillation. It's a real problem. Your heart's not beating right. Your atriums, the chambers of your heart, aren't beating correctly.
Misfiring, kind of.
Yeah. And he had to have cardioversion. This is not a HIPAA violation. This is literally he divulged this information. Afterwards, they said you can't drink any more coffee. This is a super driven guy. Do you know anybody else like that?
No.
Any type A person that likes to drink coffee? Have you ever met that person before?
No idea who you're talking about.
And so I was reading the story. I was like, oh my God, this could be me. I drink tons of coffee. It's part of my life. And what do you do when you drink tons of coffee and you're that person that's motivated? What can you substitute for that?
Well, so that's actually what got me interested in this. I am a nutritional therapy practitioner, as listeners of our podcast know, and I am also doing a Best Year of Your Life challenge because it's a big year for you. And I was getting to a place where I was drinking, because I love coffee, but I was also having some pre-workout. And then I was like, ooh, like I need a little boost in the middle of the day. So I found this pre-gaming supplement that was full of nootropics and adaptogens, but it also had a ton of caffeine. So what I found with Magic Mind was that it has all those same things. It's full of matcha. It has adaptogens, which are things that kind of help your organ systems function a little bit more appropriately or in sync with themselves a little bit better. Also has the nootropics in it that I was really loving the buzz from, but it uses just caffeine from the little bit of matcha in it, so it's very low. And what I found was after my workouts, if I throw one of these back, it like kind of almost boosts the performance of the pre-workout that I had during my workout. It kind of helps it like amplify the effect a little bit. So I love it. So I am always looking for things that I can recommend to my clients that are going to be beneficial to their health. And while I love coffee, I do know that not everyone has the caffeine tolerance that I have. I'm a high metabolizer of caffeine. I can drink a lot of caffeine and not have it negatively affect me, but that's not everybody.
Sure.
And there are definitely people who can't have caffeine for whatever reason.
I mean, if you could take me as a surgeon, I drink coffee in the morning and I operate all day long. I don't want to have a 2:00 crash. I want to be able to perform from morning until night.
Yeah, which is where like your 2 p.m.
Exactly. So you could drink this in the afternoon.
Boost.
Some people will drink this in the morning. It depends on what your schedule is.
Yeah, and that is the nice part because they are not super high in caffeine, so you can drink at any time, and you get the benefits of, like I said, the adaptogens and the nootropics. Nootropics are substances that benefit the like firing of your brain chemicals essentially. Right. So they make you think smarter. Yeah. Says the girl who's deep into a prep phase.
They make your mind magical.
They
basically.
Do. Also helps with your immunity. I mean, I have just been so impressed. Right now, they are offering our listeners an amazing discount. If you sign up for the subscribe and save, you get 40% off this cool little box, which I have. I actually saved one for Nils and Sarah because they haven't tried them yet. So I like to share the love. But share the love with all of our listeners. So definitely check them out. It's an amazing company. Dr. Martin gave you the backstory, great benefits, something that a nutritional therapy practitioner can fully support and recommend.
You have a very successful guy in Silicon Valley who made something that's for people's health. I mean, come on, we got to support this. And for all of us who drink too much coffee, me included, you have an alternative now to keep you stable throughout the day. So.
Yeah. So there's a link in our description box below, 40% off if you subscribe, which I highly recommend. It's a huge savings. In fact, we can use the link, Dr. Martin, like you and I can use the link. So 40% off. Keep them in the fridge.
Is Nils using the link?
Oh.
Yeah. Okay. Nils is using it too.
It's like so tempting. I just want to chug this right now, but I'm not going to because it's late in the day and it's dinner time. So.
But your brain would be buzzing at night.
I know it would be.
And then let's go 24 hours a day.
So show Magic Mind some love. And hey, it's like holiday time too. So if you got some people who are on your list, you don't know what to get them, maybe a subscription to Magic Mind.
Yeah, got it.
Help their health. Help their healthy.
And for a limited time, click the link in the show notes and get 50% off your subscription to Magic Mind using code BEAUTYSURGEON. That's code BEAUTYSURGEON at magicmind.com/beautysurgeon. This offer is valid up to 10 days following the airing of this episode.
We're back. I'm just going to drop some like fun Thanksgiving facts that a turkey leg is Nils' favorite fair treat. So just throwing that out there. Yep. If you want to send,
Sometimes I feel like I have a turkey leg, which is like real thick thighs, and my
you
ankles,
have the skinniest little legs.
and my
In a good
calves
way.
yeah, my calves and ankles are like nothing.
Yeah, you do have
And literally
little
today,
calves.
I did the leg day, and I was like doing my calves. I'm like, I feel like they're getting bigger. They're not.
You know what part of it is though? You have a very long tibia. You have tib fib that are very
Yeah,
long.
I feel like that's
Yeah.
kind of discriminatory.
No, I mean, but it's harder to look like have mass on a very long limb.
Yeah.
I mean, like that's just the way it is. Like your muscle may be really strong, but it's not gonna have that like tight
Yeah, I was
bubbly
doing
appearance.
some pretty big squats today.
Yeah. You got that.
All the yoked up dudes were like, that skinny guy's doing some squats over there.
Got some big energy.
I was kind of giving them the guns like
Yep,
this.
and then they all walked away.
And then they all walked away.
Yeah. All right.
Yeah.
Yep.
Hey guys.
Finger guns. All right. So let's talk about the types of thigh lift. We've mentioned this before that there are several different types of thigh lift. And as with all of the surgeries where there are names and fun things that go along with it, there's not a lot of special sauce here. You need the thigh lift you need, but these are some common terms that are used around thigh lifts. We've got your full, spiral. I love when people ask if we do spiral thigh lifts.
Like a spiral ham. Yeah.
Inner, and then like what we would consider like an extended inner or like a medial gluteal thigh
Yeah.
lift.
That's like a medial thigh lift or inner thigh lift that gets extended to your butt and takes out that
Across.
banana roll and does some other stuff over there. So
Yeah.
that's few and far between, but when we do those, they're pretty transformative.
And in our second part of this series, we will talk specifically about the incision for each of these, but just know that they all treat the leg or the thigh. Basically, we talk about like the thirds. So some of them are going to treat the upper third only. Some of them will kind of treat 2/3, and some of them will treat the entire thigh from like groin to knee. And the spiral thigh lift, it's like the deep plane facelift, the spiral thigh lift. I mean, you need the thigh lift you need. So your surgeon is the best one to tell you what surgery you need. And we have a lot of patients who are convinced that they need a full thigh lift when the improvement that they would get from that is so minuscule based
and
on
then
the
they're putting a visible scar that goes
Yeah.
from your groin down to your inner knee. This is bringing back so many Groundhog Day things. So we talked about Barbie, how like the plastic is molded together and there's a seam that goes down the midline. And that's when we talked about the scar. So like, yeah.
Well, it's where her legs hinge too. Like her
Yeah.
little Barbie's little pelvis is like
and
perfect
then we
for
talked
showing where
about the pelvis.
incision
Yeah,
goes.
we talked about the lack
Yeah.
of genitals and it looks weird. So
She had underwear on. At least
Okay.
my Barbies, they had that. It was like pre-printed on the.
yeah, and like this is where people lose the forest for the trees. They're like, I want a full, I want a mini, I want a medial thigh lift, I want a spiral. And really what you do is you offer the surgery where the loose skin and fat is. So if you have loose skin that goes from your groin down to your knee and it hangs over, water falls over itself, you're going to need a full. If you have loose skin that you don't like and it's more in the upper part of the inner leg, then you're going to need a medial or inner thigh lift. If that continues over to below your butt and even out to your saddlebags, you'll need an extended inner. And then a spiral really addresses the front of the thigh, the full length of the thigh from the groin to the knee, and also can be connected with a body lift. But getting down to the nuance of this, it really just depends on your exam, right? So I want you to empower yourself and figure out what you need. But in reality, it's very nuanced in terms of your presentation.
Yeah. And I think that also is kind of the fallacy, like the outer thigh. An outer thigh lift is really kind of a body lift, or a glute lift. There are not real ways to lift
I think
just
it's funny
the outer
that a body
thighs.
lift's a body lift, but a thigh lift's only the thigh. But you're still lifting this. The body lifts the lower extremities. The thigh lifts the lower extremities. And
I was saying the outer thigh.
Yeah, no, I understand. But then the outer thigh is where things get all messed up.
Yep.
So
Yeah.
And-
Because you don't want an incision straight across your outer thigh. And what's that really going to do?
right. And I have discussions with people. I'm like, we talk about the risk and benefits and really the cost benefit. So like visible scarring versus not having visible scarring. We try to avoid visible scarring. We try to avoid the full thigh lift incision as much as we can because that's very visible. It's hard, especially for women who want to wear like normal length dresses and stuff like that. You can see it. So, but sometimes it's unavoidable.
Well, I mean, you can, but you can't. I mean, again, we're the mansplain. Do we need to go back to
No,
the
no, don't do it.
man-spreading?
Don't do it.
Man-spreading?
Don't do
Yeah.
it.
It's not something that's like so obvious.
Then
Oh
we
my
could talk
gosh,
about our
like you need
favorite
to
muscles,
avoid
the
it.
gracilis versus
Sartorius?
sartorius.
Yeah. So just know that there are different types. We're going to
This
talk
is like
about
the best of this
kind of
podcast.
is where the incision goes for each of these in our next episode where we talk about the specifics of the surgery itself. But just know that there are different types, but ultimately the type you need is the type you need. So don't get too caught up
Well
in the
said.
verbiage. Yep.
Co-pilot.
Yeah. So let's talk about how to choose a surgeon.
Okay.
My number one making sure that your doctor, you can find the link down below, plasticsurgery.org, find a surgeon, is board
Actually,
certified.
down below, it's not down.
In the description box.
In the description box
Yep.
of the YouTube channel.
Yep.
Jason Martin, MD.
Board certified by the American
I'm
Board
really
of Plastic
picking
Surgery.
it up, fellas. Let's go.
He knows exactly what he's talking about. There is no American Board of Medical Specialties recognized as a certifying board with cosmetic surgery in its name.
What?
Yep. So
No. Really?
check the link below. Make sure your doctor's board certified. Results and aesthetic outcome that match your desire, right? So that's good. Like, look at this doctor's pictures. Understand what they're kind of thinking in their head. And someone you feel comfortable with. Like, these are the basics of picking a surgeon. This is a surgery that is very intimate in a lot of ways. Like, you are having an incision, as we will talk about in our next episode on this, really close to your private area, your groin, across your gluteal fold. You need to do this with somebody you feel comfortable with. If you are really shy and don't want to show them all of your naked body, that might not be the surgeon for you, because you're going to be spending some time
Exactly.
with no pants on
Yeah.
in front of your doctor and their staff. So,
And just to make you feel maybe a little bit better, like, we're totally fine with
like,
that.
we don't care.
We don't care.
That's what I'm saying. You feel comfortable with,
But
because we feel comfortable with
We're
it.
totally comfortable,
Yeah.
but we understand if you're not.
Yeah.
And that's okay, because we understand. We're
Mm-hmm.
human too. We have feelings like that also. So you need to be in a place you feel safe
Mm-hmm.
and taken care of, and you feel like they have your best interests in mind.
Yeah, because this is a big deal surgery, and like I said, these are some of those special considerations that come with this surgery specifically. I think that some people don't realize, like, just how exposed you will be having sutures and staples taken out of certain areas. So knowing that before you go in can help ease some of that discomfort you might feel, and just know, like, yeah, we're not uncomfortable with it. Like, this is just normal life for us.
Literally
So
our job.
yeah, we're totally good with it. Don't be embarrassed.
all
Like,
good.
we are not. All right, Dr. Martin, at the consultation.
Oh, I love it. Now, like, Sarah's doing these cards again, which I love.
Mm-hmm.
I think we need to print out the cards, because I'm really into printing out things, and send it with the patients when they go, so they can go through all these
Yeah.
questions.
So what happens at the consultation? Now, what do we do? Like, this is still, let's reiterate that you are a real doctor.
Yeah, well, I'm a real doctor.
Yeah.
So the first thing that real doctors do is they go through your medical history. They talk about your medications, your allergies, your surgery history. Do you smoke? Like,
Have you ever smoked?
Yeah. Previous surgeries, weight loss. What are you on now? Where are you with weight? Like, they go through everything, like you would at your internist. That's what we do.
Mm-hmm.
People are sometimes surprised. Wow, you're kind of want all the information. Yeah.
Gonna cut you open.
Yes. Like, I want to make sure this is okay.
Yeah.
And if you have problems, I want the paperwork. I want the paperwork on your cardiac workup or your heart workup. I want the paperwork, if I have to, on previous cosmetic surgeries. I want to be able to look at all that stuff and make a decision if this is right for you or not.
Yeah, or clearance from your orthopedist. If you've had like a hip replacement, knee replacement, like, we might want medical clearance from other doctors before you proceed with this surgery.
All right.
We'll also discuss your options. Talk to you about which of these many options, all these fancy sounding names of thigh lift, is right for you.
Right.
Expected outcome. If you did not listen to The Dark Side of Plastic Surgery, which came out in October, we talk a lot about expectations and how that can, kind of become the dark side of plastic surgery. Your doctor should talk to you about what you can expect from the surgery and provide a quote. Everybody wants to know about the money. Obviously, this is elective surgery, your self-pay. You want to know what it's going to cost. Review the risks and potential complications.
Mm-hmm.
That's something they should go over with you. Look at before and after pictures of similar expected outcomes. And this is where I think people, lose the forest through the trees with things like social media. They look at all these pictures like, oh, I want to look like that. Or I want to look like this. Like, well, that's not you. Like, we can't change, as we said, the things that thigh lift can't do, the underlying structure of your body and who you are. But we can show you pictures of people who have a similar structure to you. We have thigh lift pictures of patients who are all different heights. I mean, and you can't tell these things when you're looking at a tiny little square on your phone. It looks like everybody's legs are the same length, right? You don't know that patient's literally 4'9".
Or 5'10".
Right. You can't tell. So having your doctor show you pictures of people in your same age group with your same skin integrity, those things are meaningful. Like, far more meaningful than what you might just find randomly on the internet. So definitely, look at pictures, and they should answer any questions that you have.
Yep.
Yeah. What are some questions that they should ask you?
If I'm board certified, no one ever does, even though we raise this alarm.
That's because they've already looked. They already checked the website before they came in.
Are you, or am I? I'm sorry, I'm the person. I am the patient right now. Okay. Am I, Dr. Martin? Am I a good candidate for this procedure?
That's a good question to ask.
What surgical technique is recommended for me? I like that question.
Mm-hmm.
Like, hey, am I good for an inner thigh lift, or a full, or a spiral, or inner extended?
Your doctor doesn't need you to know those terms.
Yeah. Where and how will my surgery be performed? That's a really good question. Hey, where do you perform your surgeries? This is a pretty long surgery. It's a little involved. Is that place certified? Is it at a hospital? What if I have a problem? Where do I go from there? That kind of stuff. What are the risks and potential complications with the thigh lift? And there are definitive ones with this surgery.
We will cover them in detail in episode 2.
Will I need liposuction? The answer is probably yes. With the additional skin removal, let's talk about complications. What happens if we have complications? How do you handle that? How long is recovery? How much help will I need during recovery? You need help during this recovery. If you're someone that lives alone and you have no one you can rely on, this is a hard surgery to do by yourself. Yeah. We've had a few patients like that, and inevitably they all end up calling us crying. So it's a very you need
even
help.
the ones with help cry.
Yeah. How do I expect my thighs to look after surgery and with age? Is like a really, really good question. And some people, I could say, hey man, this could last a long time. Other ones I'll say, look, you already have a baseline loose skin problem. You're probably gonna have a little bit of recurrence no matter how tight we pull this. So
yeah, because
these are
unfortunately
really good
your leg
questions.
still needs to bend. So this is one surgery where you have to take that into account. Your hip joint is a powerful joint. It's a powerful mover. It helps you stand, it helps you sit. You have to be able to curl up in a ball and stretch all the way out. Like it does a lot of things. It extends, it flexes, it abducts, it adducts. Your hip moves in many different directions, and you can't have surgery restrict that range of motion, or you should not. So in people's minds, we always talk about the aggressively pulling on the thighs. Right. But can you sit like that? Can you spread your legs?
There was a comment that someone picked up because I said these patients come in and violently pull up in their thighs, and the person who responded was like, I was really cracking up at that. And then we had a patient, literally a telehealth appointment. She's like, I'm not violently pulling up on my thighs right now, which I thought was really funny because she's like, look, I'm really trying hard not to pull up too tight right now to show you what I want. It was very funny.
Yeah. So, that's something.
So don't
again,
violently pull up on your thighs.
But with the special considerations, again, with thigh lift, that's one of them. This is a mobile joint. You're having surgery around, sometimes all the way around a joint that moves in many directions. So as tight as you think it can be pulled in your head, it probably can't be pulled that tight. Someone asked, said it was a trick question on one of our YouTube videos recently, like, how tight can you pull? I'm like, haha, trick question.
Trick.
Right? You can pull as hard
You're
as
not
you
gonna
can.
pull us in.
Right? You pull as hard as
When
you
you dip,
can.
I dip, we dip. I know what you're doing right now.
Yeah, based on the location of surgery, the patient's skin, like all those
Come on,
things.
No, we don't fall into
Right?
that. We're experts.
We'll pull as hard as we can in the given
Keep
situation.
those questions coming.
Yes.
Who was the guy who was the YouTube doctor that always
Dave.
Dave.
Medical school Dave.
That was probably Dave masquerading as a different name.
Well, he didn't win. All right. So you've decided, you found the perfect surgeon for you. You have found your surgeon. You have gone to your consultation. You know what it's going to cost. You have scheduled surgery. Now comes the pre-op appointment.
Yep.
The very first thing you should be prepared for at this appointment is they will take pre-op photos.
With most likely
No
your
clothes
underwear
on.
off. Yeah.
Yep. You will absolutely be naked from the waist down. You'll be Winnie the Pooh. So be ready for that. These
I
are
just
part of
got
your
that.
medical history.
I just got that.
Right? Donald Duck.
That is very funny. Like they didn't put any pants on him. Yeah. This is shirt.
Mickey and Minnie got pants. So yes, they will take your pre-op photos. These are part of your medical history. Sometimes people ask, like, why do you take so many pictures? We take these pictures because these are literally, we're changing things about your body. The only way to know what, really what you looked like before is to take pictures, to, have this as part of your medical history. Review your health history, your labs, all this again. So we will go over all your health history again, all of it. We'll send you for probably some pre-op labs, potentially an EKG, talk to you about what medications you're taking, when you can stop and start those medications pre and prior to surgery, discuss your labs, EKG, sign consents, take your payment. Everybody wants to get paid. This is elective surgery. Most every doctor's office is going to require that you pay prior to surgery.
Beforehand.
Get your prescriptions, review the date and time of surgery, and answer any questions you have. So what are some questions they should ask, Dr. Martin?
Number one, am I going to stay overnight?
Or why am I staying overnight?
Yeah.
Yep. You'll have drains.
Some people don't. Some
Mobility is
people do.
limited.
It depends on what the surgeon prefers. What medications will I get prescribed? And what was that? It was a recent episode. We talked about people saying that they didn't have their medications, even though we told them 12 times where to pick them up.
Oh, people do that all the time.
Yeah.
Yep. And asking what medications you will be given at the hospital too, I think is a good question to ask. That again, we've reviewed your medical history many times. And that's when people are like, oh, I took this medication once that I was violently allergic to. I'm like, oh, that's nowhere in your health history.
Yeah, I think a good question is about the bandages and the garments you wear afterwards. A lot of times with thigh lifts, we'll put garments on. So that's going to be a good question.
Yep. And when can they be removed?
Right. Drains. A lot of times with thigh lifts, in most cases, most surgeons are going to use drains. How do I take care of those drains? When are those coming out? How much does that hurt? Showering is a real tough question because some people will let you shower, some won't. And when can I return to normal activity and exercise? That's a real big question with thigh lifts, and that can be a gestalt. That can be differing for everyone, but it's not going to be right away. This is a slow healing surgery. It's one of the more
high tension.
Yeah, it's not what I'd say super painful as it's just really annoying.
Yep, it's
and so
uncomfortable.
because it affects every part of your movement. As we talked about, it's in the Barbie leg where the Barbie leg hinges. That's where the incision goes. So every time your leg moves, every time you sit down, every time you lay down,
sit down, stand up, getting in and out of cars. Oh
all
my
that
goodness.
stuff.
Like all those things. And we've pulled as tight as we can.
because we got to get your money.
Because we've pulled as tight as we can. So, there are going to be movements that initially you cannot perform because we've pulled too tight. Like now, eventually that will soften up and loosen so you'll be able to do those things again. But like sitting down on a hard surface, like not for a while.
Nope.
So there are a lot of things to think about with this surgery. And, these are questions that you should definitely get the answers to prior to surgery, just so you're prepared. Again, expectation management is key. And with that, Dr. Martin, my expectation is we are going to come back
for part
in 2 weeks.
For part 2.
And we're going to talk less about candy corn. Even though.
What do you think Element's going to send us then?
I don't know. Yeah, maybe.
Yeah.
I
don't know.
wonder if you could brine turkey in Element.
Oh my God.
I bet you could.
That's just disgusting.
Ooh. No, like
You know?
it is. You could use the citrus. Oh my gosh, you do like a citrus
Oh my God, that
turkey
sounds
breast.
Disgusting.
That sounds amazing with like some tarragon. Oh, I am so doing this.
All right.
Element, hit me up.
Yeah.
I will make like some tarragon
Yeah,
citrus chicken or turkey breast.
Element is like absolutely not going to send you something.
So
again.
good. Ooh, our salted caramel tart with the chocolate with the
so
chocolate caramel. I got skills. Yep, I got those kitchen
our
skills.
last Thanksgiving, I'll tell you the story before we go. So our family members were cooking the turkey and they cooked it upside down. Have you ever seen this?
Oh, with the breast down
Yeah.
instead of up.
And so they thought it was done because they kept measuring it because it's not as thick.
They were doing it into the ribs, not the thigh.
Totally.
Oh,
Oh.
man.
And they brought, and I'm the guy because I'm the surgeon and both sides of the family that can actually carve the turkey. So that's my job.
I mean, I would. Yeah.
And they pulled it out, and I was like, "This turkey doesn't look normal." And I was like, "Oh, it's upside down." I turned it over. The other side was uncooked.
Completely raw.
Yeah, it was.
Oh my gosh.
It was entertaining, but then it was like an hour later.
Yeah.
Oh,
Yeah.
or more. Man, turkeys
Yeah.
take forever.
Very
Right? Oh, that is funny.
All right.
All right,
So we got a part 2 of thigh lift, right, Amy?
Yep,
2
part
weeks?
2 is coming. So in the meantime, if you have any questions, please leave us a comment, a rating, a review. We would love it if you would share this episode with your friends. If you know anyone who's as obsessed with candy corn as me, shout out to you because you're the best. Leave us a comment, a rating, a review. We really do appreciate it. It's how people find us. It's probably how you found us. You can also leave us a voicemail, 303-630-9038. That's all I got.
That's all I got to.
All right. We'll see everybody here next time for part 2.
See you next episode.